Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Gallbladder and its diagnostic evaluation. So the major important ones, it includes the gallbladder US, that is the ultrasound. So this is nothing but the IOC, that is the investigation of choice for the detection of gallstones. So this is for detecting the gallstones. Next is the presence of the abdominal X-ray. So in terms of the abdominal X-ray, it is useful in terms of the calcified gallstones. So it is useful in terms of the calcified gallstones. Next, in terms of the emphysematous cholecystitis. Then in terms of the porcelain gallbladder, then limy bile, gallstone ileus, now let's look at the radioisotope scans. So in terms of the radioisotope scans, it includes the HIDA, then DIDA, as well as the DICIDA. So let's look at what is indicated here. So the indication is for the confirmation of suspected acute cholecystitis. So it is indicated for the confirmation, and this is of the suspected acute cholecystitis. In terms of the suspected acute cholecystitis. Next is, it is useful in the diagnosis of acalculous cholecystopathy. The diagnosis of the acalculous cholecystopathy. So we learned about HIDA, DIDA and DICIDA. So let's just look at the full forms. So HIDA is nothing but the hepatobiliary immunodiazetic acid. Now what is this DIDA? DIDA is for, it stands for the diisopropyl immunodiacetic acid. So this is by a dynamic TC99 DIDA cholecystography. So this is by the dynamic TC99M DIDA cholecystography. To learn and grow daily like this, please do subscribe.